welcome to McLeod's Medlive Scientific Session Summary. Today we are at Day 2 CSICON 2019 being held at the Ashoka Hotel, New Delhi. I am Dr. Rahul Kotwal from medical team of McLeod's Pharmaceuticals. Today we have Dr. A. Srinivas Kumar with us, who is Chairman CSINIC and Director of Cardiology at Apollo Hospitals, Hyderabad. He has delivered a session on left main interventions. So sir, first and foremost we welcome you to the channel and we request you to summarize your session for the benefit of the fraternity.
Yeah, first of all, let me thank all the CSI colleagues across the country for giving the opportunity to be as the chairman CSI NIC, and thanks for all the cooperation extended. And in our yesterday's Hall B sessions of interventions, we had interesting discussions on various important topics, out of which the most important would be to left main interventions. Left main disease, as we understand, is an important area because a lot of portion of the heart is at compromise when the left main gets diseased, and patient would develop sudden problems if it is not tackled. Previously it was only in the surgical era, so only surgeons used to operate when we had a left main disease, but thanks to the technology evolution of imaging and better quality stents, and the recent data, Excel and other trials showing the positive results even with intervention, we have got a new method to treat these patients percutaneously. Then the initial discussions were on which type of patients to be selected for left main interventions and what are the criteria by which you assess both imaging wise as well as FFR wise. Then afterwards, how to tackle these lesions very well, and osteal and shaft lesions have almost become totally independent of surgeons, but left main bifurcation, sometimes you have disease, we need a heart team approach, and where we need to discuss with our surgical colleagues and try to do what is best for the patients. And the imaging, importance of imaging in the assessment of lesion, as well as proper assessment of after the stent, how to be tackled it, both by IVUS and OCT, the pros and cons of each imaging were discussed. And then finally we concluded saying that if procedure is done right by image guidance, all these patients could have good long-term outcomes as shown in the recent data of Excel and other trials. But only thing which is very important is we can't be complacent and we need to get the optimum results with image guidance. The also discussion was on the criteria of successful left main intervention, on the criteria which is proposed by Korean group of 5, 6, 7, 8. But what was also discussed was that is the minimal areas which is achieved, but we need to try to get the best for these patients. And which type of stents to be used in this intervention again is the area of discussion, because we need to have a stent which can expand differentially, because you have a stent which in the LED which needs a lesser size, and the left main it has to be expanding to bigger dimension. So we need to take care of that, and which type of stents we are using, what is the maximum expansion diameter this can go up is also important, because the proximal and distal stent anatomy should not get distorted. And after the procedure, again, it's very important for us to understand the newer antiplatelet drugs like ticagrelor, aspirin, and also usage of statin is very important in these patients to prevent recurrent events and patient coming back again. So with this message that left main intervention is now the present reality, and it can be done, tackled effectively by percutaneous intervention. You need to take the help of optimal imaging, and then probably after the procedure again patient needs to be taking proper dose of antiplatelets and statin drugs so that they will have proper long-term outcomes which are good for the patients, and all our patients will be doing fine with this intervention. We also stress the importance of heart team, and both surgical colleagues and cardiologists together should take a combined decision which is good for the patient. And with a very heartening news that this again left main interventions have become a reality today, and now NIC we do have patients of about 1,000 plus interventions reported from our society across the country, and we do very happy to note that imaging and the overall interventions again has increased to up to 5% in our registry data. Thank you once again, and I wish you all success in future for all the colleagues of CSI.
Thank you, sir, for the wonderful summary. I hope all of the audience might have gained a good insights and guidance through this informative session. Though because of time constraint, many of the doubts might have not got cleared, which we definitely look forward to have in the comment section below. So thank you, sir, for being the part of our Medlive channel. Thank you.